everyone for joining. Thanks to USTOA for inviting me. I just briefly said that I'm the chief for the Quarantine Health Branch as introduced, but I am one of the leads for the Global Migration Task Force in the Zika response. And CDC activates various task forces whenever there's an event of public health importance, as the Zika outbreak in the Americas is. My presentation will kind of cover these three themes, and it overlaps more or less with some of the questions that were asked from your group. What is the Zika virus? More importantly, I think you want to know what are your risks and what precautions you should take if your people come to your offices who travel to regions where there's Zika, and then what resources does CDC have that you can use. So what is the Zika virus? So in 1947, some persons researching yellow fever, which is a very deadly disease in different parts of the world, including Africa and South America, were trying to place a rhesus monkey in a cage in what was called the Zika forest in Entebbe, Uganda, to try to isolate the yellow fever virus. Zika means overgrown in the language used in that region. However, instead of identifying the yellow fever virus, they found another virus, and they named it Zika because of the region in which it was found. So Zika is spread primarily, although with the most recent outbreak we are learning of other means of spread. It's spread primarily through the bite of the Aedes species mosquito. So the two main species are Aedes aegypti and Aedes albopictus. Most often it's by Aedes aegypti, but albopictus is also not as efficient but can also cause spread of the disease. It's important to note that many people who are infected with Zika do not have symptoms, or their symptoms may be mild, and then they may not know that it's that infection. Aedes also spreads to other diseases of importance, dengue, and also chikungunya. And all three of those diseases are now present in the Americas. So where is it now found? So before last year, it had mainly occurred in Africa, Southeast Asia, and the Pacific Islands. But currently, it affects many regions and territories, most recently in the Americas. And this map, which may not come across so great, shows the region in the Americas which is now impacted. So essentially, all of the rest of North America, that is Mexico, Central America, and the northern parts of South America and all of the Caribbean. And even though some islands in the Caribbean may not yet report it, if it follows the trend with chikungunya, we expect that everywhere in this region will be impacted, especially as we get to the warmer months of the year. This next slide shows some travel volumes related to the US, which may be important to you. So the United States has over 300 official ports of entry. We're talking about airports. No, there are more airports in the United States, but ones that are official ports of entry where Customs and Border Protection would be. And travel from countries with Zika occur through about 60% of those. So you see that in last year, by air, about 101 million persons traveled by air. And from Zika-affected countries, about 35 million traveled by air. Mexico, of course, is impacted, and a lot of travel occurs across the U.S.-Mexico border, and accounts for much of the 234 million travelers. And Zika affected travel, mostly from Mexico, is a huge proportion of that, of course. So, you can see that Zika, we are in this hemisphere, of course. We have very close relationships with Caribbean countries and other Latin American countries. So, it's a lot of travelers to that region. So everybody's going to be wondering, what is my risk? What do I need to do? So how is it transmitted? As I said, it's through the bite of the mosquito primarily, But we now know that a pregnant woman can pass it to her unborn child, her developing child, the fetus. We also now know that it can be spread by sexual contact. And we knew for some time that it could be spread by blood transfusion. So the two most recent events that we know for transmission are, although they're much more rare, are pregnant women to her fetus, and from a man most commonly by sexual contact. But it is thought that a man is going to be a more efficient transmitter of the virus than a woman in the sexual contact. We have not had any evidence so far of a woman passing the disease to a man through sexual intercourse. So the symptoms are common. They're what you see for many other diseases. So you can't necessarily say that a person has Zika just based on symptoms. Although in the context of an outbreak, we're in a country that has a lot of the outbreak occurring, you can be relatively confident. The problem is in the Caribbean and the Americas now is that dengue is currently present there, and so is chikungunya. So some of the disease we call Zika may be any of those other diseases. But the symptoms are fever, rash, joint pain, and red eyes, conjunctivitis. People may also have muscle pain, and people may also have headache. So how does the Zika virus affect you? So anybody who lives or travels to an area with Zika and you have not already been infected by that virus, you can get it. So most persons from North America, meaning Canada and USA, not including Mexico, who travel to a Zika-affected country, I'm assuming they have not traveled there recently and were infected, are at risk of getting the disease. As I said before, many people infected with Zika virus will not have symptoms or will only have mild symptoms. About 80% of people actually will not present with any symptoms. So the Zika virus can pass from the woman to her fetus during pregnancy around the time of birth. Unfortunately, this infection in a pregnant woman is associated with adverse brain defects, microcephaly, that's a small head, and we also know that there are other impacts on the fetal brain. So we're really concerned, especially in this context now, for pregnant women because of the potential impact on the baby. There's strong evidence that it also causes another disease called Guillain-Barré syndrome. So Guillain-Barré is a paralytic type disease. Other infections can also predispose to Guillain-Barré. Campylobacter infections are is the other most common one. So it is thought that it may be triggered by the Zika virus in a small proportion of people, as it is for other infections. It is a relatively uncommon illness of the sickness of the nervous system, in which your immune system essentially fights the nerve cells and can cause muscle weakness and paralysis, including paralysis of your diaphragm. And if your diaphragm is paralyzed, then you can't breathe. And those people then need to be put on a ventilator to support their breathing. Now, if in a country like North America, where you're given appropriate support, there are no treatment, and I'm talking about Guillain-Barré now, most of those people will recover, but it is a potentially serious disease as well. But it's much more rarely seen, and there's still evidence being gathered to try to link it definitively with the Zika infection. But the evidence seems very highly suggestive. So we diagnose the disease based on the person's travel history, the symptoms they present, and by taking blood and the results of the blood test. It's the only way to confirm a Zika virus infection. Now, in the context of an outbreak, and resources to test everyone, we may make some assumptions that the symptoms you present with, based on your travel history, is Zika. But we won't know for sure unless we test you and we get a confirmatory report from a lab. As I said before, the symptoms are similar to other illnesses spread through the bite of the mosquito, like dengue and chikungunya. So if we need to confirm your diagnosis, we may then need to get your blood tested. There's unfortunately no specific medicine for Zika, and as of now, there are no vaccines to prevent Zika. So the prevention is mainly going to be behavioral methods which involve avoiding the bite of a mosquito. So if someone gets ill, we treat the symptoms, and that will include in having the person rest, make sure they keep well hydrated by drinking lots of fluids, and taking painkillers such as acetaminophen to reduce fever and pain. Now, there are other painkillers. One of the issues in some of these Caribbean countries is that because dengue is present, and dengue can present with hemorrhagic symptoms, some of the other painkillers like aspirin actually also cause bleeding. So we are careful about using that because you may have dengue fever, and giving a drug like aspirin or some of the other drugs may promote bleeding. So acetaminophen, Tylenol is the safest medication to use. But if you are diagnosed and we know that it's not any of those other illnesses, then and your pain is severe, we may then give you one of the stronger pain medicines. The best way to protect to not get ill is to protect yourself. As I said, there is no vaccine. And so mosquito avoidance methods are most important. As you said, when you're bitten by the virus, it can be found in the blood. Then if it's in your blood and a mosquito bites you, then that also promotes spread of the virus to somebody else if that mosquito then goes and bites another person. So people are ill, but people do not transmit, except for the sexual transmission route. They do not transmit the virus directly in most cases to other people. The mosquito is the main source of spreading the disease. Now, one of the things I will say though, for travel, the virus is introduced into a country not typically by a mosquito, because mosquitoes have a limited flight distance, and they're probably, the likelihood of an infected mosquito getting onto a plane and into another country is very rare. So the mosquito, the disease spreads from one country to another country mainly by people. But within that country, the mosquito is then spread, the virus is then spread from person via the mosquito to another person. So we put a lot of emphasis on trying to prevent mosquito bites. And this is just to stress that point again. And I know one of the questions, when you go to the Caribbean, for example, I know everybody goes to the beach and you're going to be in your swimsuit. So you said, what do I do if I can't wear long sleeve clothes if I want to swim? But there are things you can do. So one of the things, if you are in a hotel, you want to use an air-conditioned hotel if possible, because mosquitoes don't like cold environments. So stay in places with air conditioning, and where there's a window or doors and door screens so that mosquitoes can't get in. Don't leave those doors open or propped open. And if possible, carry a bed net or use a bed net if there are no air-conditioned or screened routes. So if you're going camping or into the mountains, again, above a certain elevation, when it gets cool, the mosquitoes won't be there, but in certain other areas there may be. So if you're going to be doing outdoor activities below, I think it's about 10,000 feet, but I'm not 100% sure of the level, it is best to use some form of bed netting to protect yourselves when you're outdoors. If you're not on the beach, cover up by wearing long sleeve shirts and long pants. So other than when you are going to be in that type of activity, you should try to cover yourself. Now, of course, these countries are also primarily hot. So, wear loose-fitting, cool type clothes as well, so you don't run into the risk of dehydration. You can treat your clothes. You can buy clothes that's treated with insecticides. So permethrin is used to treat clothing or gear, or as I said, you can buy clothing that's already treated. And then read the product information to find out how long it lasts. Now, DEET, for example, is one of the is another product that's often used. It's important to read the instructions because the length of protection depends on the strength of the compound that's used. So very often people buy the cheaper one, but the thing with the cheaper one is that they may last only 2 hours, whereas some of the others with stronger doses in them will last up to 8 hours or so. So read the directions carefully so that you know how long the protection you have will last. Use EPA registered insect repellents, and usually all the ones that are on sale in most drugstores would be EPA approved. The recommended ones are those with DEET, picaridin, IR535, or oil of lemon eucalyptus, or paramethane diol. Again, read the product instructions, see that it's EPA approved as an insect repellent, and those will usually be good products to use. These are also listed on CDC website. So again, always follow the product instructions. Do not spray repellent on the skin under your clothing. So usually it's best if you're putting on clothes and the clothes are not treated to spray over the clothes and then spray your exposed skin. Do not, for example, open your shirt and spray over your chest and then cover that up. If you're also using sunscreen, put on the sunscreen first and then apply your insect repellent, because you want the repellent to be the outer barrier layer that comes into contact with the insect first. So you need to protect your family as well, and protecting your family if they're with you, but for men especially, if you travel, there are now added responsibilities to protect your family and surroundings when you're with your wife specifically. So for babies, you should not use the repellents on babies that are younger than 2 months old, because their skin are going to be more sensitive. Some of these products, they don't sting per se, but the child tends to, skin is more absorbent, so they may actually get a higher dose. So for those, we recommend that they not be used. So barrier methods and covering up the child is probably the best thing to do for a 2-month-old child. Also, it's recommended that you not use oil of lemon, eucalyptus, or the paramethane products for children less than 3 years old. Also for children, we say you should not apply it onto their hands, because children tend to put their hands into their mouth, into their eyes, on their mouth, or any cuts or irritated skin. The adults should spray it onto their hands and then apply it to the child's face, avoiding the mouth and eyes, of course. So the best thing, as I said earlier, is for babies is to try to cover them, especially when they're sleeping, and wear loose clothing on them. For those under 2 months of age, you really want to protect them. Now, there's no known risk in terms of microcephaly, etc., for a child already born. As far as we now know, that effect only affects the developing fetus, the microcephaly. But so we are saying not use it in those young children, because the product themselves, they may absorb a higher proportion of that, and could be more, the effect on the child is going to be potentially more harmful than the effect on an adult. Now, children expose a larger surface to volume ratio. That's what we term it. So their dose of absorption is usually going to be higher than for an adult. So as we now know, since it is spread by sexual intercourse, it is important for men to protect their partners. So the Zika virus can be spread by a man to their partners during sexual intercourse. In all known cases so far where there have been sexual transmission, the man has been symptomatic with symptoms that seem to be Zika. They have either been diagnosed or they are highly symptomatic. But we don't know for sure that a man who is infected but not showing symptoms, it is possible that he could still spread the virus. But so far, all of the cases known have been among men who are symptomatic. The problem is that, as I said, a lot of people are asymptomatic, so we can't rule out the fact that a man was asymptomatic, he spread it to somebody else, but that person is also asymptomatic. As I said, so one of the things we know now about semen is that the virus stays longer in the semen than it does in the blood. So what is happening here? Now, there are certain parts in the body that are what we call immunologically protected. So in essence, the body doesn't want to be fighting itself. So your brain is one, so one such area. The semen in men is another such area. Your eyes are another such area. If the virus gets into those areas, then the body's own defenses won't be able to, your antibodies won't be able to get into those spaces to fight the virus. And so the virus may persist in those spaces. If the virus can then leave that space, as for example, leaving the semen during sexual intercourse, then the virus can also get out of the body and affect another person. So we don't know for sure how long the virus can stay in the semen of the men who have Zika virus infection, or how long the virus can be spread through sex. But at the present time, we're giving recommendations that if a man is symptomatic, they should avoid sexual intercourse for approximately 6 months. If they're not symptomatic, we still recommend that they avoid intercourse or use a condom for approximately 2 months. And of course, if you abstain, then there's no risk of transmission. We also don't know if the sexual transmission route will pose the same risk for birth defects as is by transmission by the mosquito. So far, none of the sexual transmitted cases have been in a woman who then gets pregnant. So as I said, not having sex is the only safe way to know that you won't get it transmitted by the sexual route. But if abstinence is not for you, but then using a condom is the next best way. But you have to use a condom every time you have sex. And the aim here, of course, is to prevent transmission, but also to prevent pregnancy, because we know of the potential risk that could affect the baby. And this is vaginal sex, anal sex, or oral sex. So what should you do after you return? So even if you do not feel ill, when you return to the United States, you should take steps to prevent mosquito bites for about 3 weeks. This will help introducing the virus into the mosquito population in the United States. So both Aedes aegypti and Aedes albopictus are present in the United States. In the winter months, those mosquitoes are dormant, but as we are now getting warmer, the southern states especially will start to see increased mosquito activity. So the recommendation is that for that period of time, 3 weeks, enough time for the virus to die, we expect then, at least by transmission from a mosquito biting somebody and absorbing it from the blood of that person. If you avoid, if you protect yourself from mosquito bites for about 3 weeks, that should limit the introduction of the virus into the mosquito population. We recommend that men should use condoms for at least 8 weeks to protect their sexual partners. If the man is symptomatic, we're recommending that that be for up to 6 months. So one of the things to do before you travel, and this is where your organization would come in, is to know what the recommendations are for specific destinations. So CDC currently has what we call a level 2 travel notice for countries with Zika, and I'll explain the different levels in the next slide. So if you probably know this page already, but you can find information about Zika virus related to travel on the CDC Zika travel page on the section shown here on this slide. If you have problems, you can just go to cdc.gov travel, And once you get to that page, you can then find the Zika notices as well. So we have 3 levels of warning. Level 1 is a watch, where we tell people to follow precautions. So usually we're saying there's some disease occurring in this country. We want you to know about it, but we're not necessarily asking you to do anything different except use the usual precautions to protect yourself. For level 2 notice, usually we are going to have some enhanced precautions for at least one group. So in this instance, we are having the level 2 notice because we are telling especially pregnant women to take enhanced precautions. In fact, we're recommending that pregnant women not travel to the region where there are Zika outbreaks. For level 3 warning, as we did recently with Ebola, we advise that there should be no non-essential travel. So only travel that's absolutely essential, such as humanitarian workers to West Africa during the Ebola outbreak. So, as I said, we recommend that pregnant women not travel. If people must travel, we recommend that they speak to their doctor or other healthcare provider before their trip. Especially if they are pregnant, they should get appropriate advice on what to do if they plan to travel to a region with Zika. If you do travel, you should follow the steps as outlined to protect yourselves from mosquito bites and to protect your family. And as I said, even if you do not feel ill when you return, you should still protect yourself from mosquito bites because that will reduce the likelihood of the introduction of the virus into the United States. So, as I said, if you go to www.cdc.gov travel, you can see all the information we currently have with respect to Zika affected countries. You can also go to a specific country that you're traveling to on that website and look up Zika. When you look up the country, it will tell you whether or not Zika or other diseases of interest are occurring in that country. So I'm sure the travel industry has this website on their favorites list. This is just another example of the information of that website and the different travel health notices that can be found. The travel health branch within CDC produces the Yellow Book. So if you want a hard copy information of travel risks to specific destinations, the Yellow Book is available. It is also available online, though, and the online version is updated regularly. There's also a mobile app that, especially for potential gastrointestinal type diseases, if you download this app to your phone, when you travel, you can ask it questions about things that are safe to eat. And that, I think, is my last slide. So I'm open for any questions.
Well, thank you very much, Dr. Brown. So if any of our members would like to ask verbally a question, you may do so now, or you could also type one in the message box on the lower left-hand corner. So maybe just to kick things off, Dr. Brown, I'll ask you a question. And as you know, family travel and multi-generational travel is increasingly popular today. So one of our members was curious to know, are the risks for Zika different for children and teens compared to adults?
Right. So right now we only have different notices for women because of the risk to the unborn baby. Mm-hmm. Now, of course, in general, so teens are going to be fine unless there's a pregnant female teen. But in general, the very young and the very old tend to be more susceptible to different diseases. So I would say you're more worried about children, not because of Zika itself, just because they're more susceptible individuals. But teenagers are going to be probably not even notice that they're ill. As I said, 80% of the people who get Zika do not even know that they have Zika virus infections. But the main precautions are aimed at pregnant women.
Okay. And I see that there is a question here, Dr. Brown, from Tahiti Tourism. And I don't know whether you can see it in front of you as well, but it asks the question, if 75% of a given population in a contained area has previously been affected and cannot become reinfected, is it safe to say that that contained area is a Zika-free zone for a period of a few years?
Yeah, so that's a very technical question. So in general, yes. So as I said, once you have the infection, you have a level of immunity, and you won't get it already. Those individuals won't get it again. So there is what we call kind of herd immunity. Now, I don't know if 75% is the right level or not. I'm not sure we have studied Zika enough for anybody to commit to that number. But certainly, if there's a lot of people infected in that country, the likelihood of transmission is going to be less. Now, you have to remember, though, that if you travel to that country, you are, and most Americans are not going to be infected. So that doesn't mean that the risk for you is going to be totally zero. But it certainly means it's going to be much less. So if you go to the Travelers Health website, you see that we have our notices in some different groups. So there are countries that we say are endemic, and I would say if the disease has reached that level, there's a certain level of endemicity there, so there's no active outbreak occurring. But I couldn't say that it's 75% that level is. Mm-hmm. So yes, the risk of disease occurrence is going to be potentially low just because there's so much protection amongst the people there. And when that happens, the virus will tend to eventually die out because there's kind of nobody else to pass the disease on to. But it wouldn't have gone to zero, and this is why, for example, the disease has moved from certain areas now into the Americas.
Right. Okay, and I see a question has come in from Emma Petrie, and she indicates that she recently returned from Rio, where they are more concerned with, and Doctor, you'll have to help me with the pronunciation.
Chikungunya.
Thank you very much. What is the difference, and why are we not hearing about this versus Zika?
Oh, so, well, people should have heard about chikungunya up to last year. So chikungunya started in one of the French Caribbean islands year before last, 2014, and really swept through the Caribbean first, then into South America. So there's still chikungunya and dengue occurring in the region, but in relation to the question that was just asked before this one, most people in those countries now have chikungunya, and so it is not spreading because there's not a susceptible population to get chikungunya. So, I mean, Brazil, as far as I know, did have that outbreak, and I'm actually not sure that they are more concerned about it, but I wouldn't swear. But yes, chikungunya is in the Caribbean and is in the Latin American countries as well. It has similar symptoms. We did not have the same sort of issues with pregnant women in chikungunya as we did with Zika. So that is why there is a concern because of microcephaly in the babies. If it was exactly like chikungunya, I don't think we would have been worried. But the concern has come up mainly because of microcephaly and other brain defects in the women, in the babies. Chikungunya causes severe pain. My wife got it when we went to Jamaica. I literally bathed myself with insect repellent. She was not as aggressive as I was. And the problem with chikungunya is that she had knee surgery, and it seems to find where the defect in your body is, and then after you recover, you get these recurrences for up to a year after. but it's painful, but it's not, for the most part, did not have any severe outcomes compared to what we know with Zika in pregnant women. So the concern is because of what's happening in microcephaly, and also the potential link with Guillain-Barré syndrome, which is a paralysis which can be fatal.
All right, thank you very much. And I see Jeannie has written saying, if someone wishes to get pregnant in the coming years and they get infected now, how many years would they have to wait before they are safe to try to get pregnant?
Yeah, so there's so that's another tough question where, because we now know about the disease for this association with microcephaly in babies born to pregnant women who got Zika, it is hard to answer. We do not think there's going to be any persistence in the woman to cause any problems with her subsequent pregnancies.
Okay, and let me just ask, does anyone have a question that they'd like to ask Dr. Brown? Well, if not, Doctor, I think we've covered all the ones that have come in through the message box. And let me just reiterate how much we appreciate your time. This has been extremely valuable. We have taped this, so it will be in our members' room on our website. So those members who were unable to participate today will be able to view it shortly after this. So again, Dr. Brown, thank you, and we wish you all the success in your work at CDC. Thank you very much. Take care.
Thank you.
Bye-bye.
Bye.